First of all, it's a great honor for me to be with you here at this conference. This is my third ADAO conference I'm attending, and it's also a great honor to me to have this presentation. Thank you, Linda and Laurie, that I have the opportunity to give you an overview of our situation, how it is in Germany now. Myself, I'm an occupational physician. I work at this university clinic in Cologne, and you see here our main hospital building, almost midnight now. That's how it looks at this time here. And I'm also teaching occupational medicine and occupational diseases at the University of Applied Sciences in Bonn-Rhein-Sieg. So what's going on in Germany? You see, the usage or consumption of asbestos was very low during the World War II because we don't have asbestos mines in Germany, so we have to import it, and during this time there was no import during the war. It increased in the 50s up to the 60s and 70s and in the 80s, and the maximum consumption of asbestos products in Germany was around 180,000 tons a year. This was in the 70s and in the 60s and in the 80s. This was our maximum period of asbestos consumption during this time. You see, this lung cancer was already considered as an occupational disease in the list of occupational diseases in Germany in the year of 1942. Long before this happens, long before this consumption in this extent happens. So it was a listed occupational disease by law in Germany in 1942, lung cancer in association with asbestosis. And still this was going on. Asbestos-related mesothelioma was an occupational disease in 1977. Also, when you read the German textbooks in the 50s, they state already that asbestos causes mesothelioma. It took around 20 years that it was in the list of occupational disease in the 1977. We have a laryngeal cancer, which comes to the list of occupational disease in 1997, and it can be compensated as an occupational disease when it is exposed to asbestos. So here you see the disease, lung cancer, and red is mesothelioma. And due to the latency period, which in average for mesothelioma in Germany now is 40 years, and we expect it will be longer even in the next years. And mesothelioma cases are still increasing very steeply, and at the moment we have yearly 950 compensated occupational mesothelioma cases, and we have approximately around 750 lung cancer due to asbestos. As I said, we don't have asbestos mines in Germany, so most of the exposure was in these different branches. The most women worked with asbestos textiles. There was production and use of asbestos boards and press boards for isolation, asbestos cement products, and for the construction, friction materials, and asbestos insulations. These are data from our cohort study we did, where we watched the mortality of these asbestos-exposed workers. This is obviously not Germany, as everybody can see, and it's not in the 1960s. But these working conditions we also see on pictures when we see workplaces in Germany in the 60s and in the 70s. It was almost the same, but you see this is China and this is 2007. And you see this work with pure asbestos and loading of asbestos and almost no protection of the workers. This is a picture from the New Zurich newspaper from 2008. But this was the exposure we had 40 years ago, and it's still going on in the world, as we heard today also. So there was an article in the German weekly newspaper Die Zeit, and it's in English, The Deadly Wonder, and there was an article which covers all the 100 years use of asbestos since almost 1900 until today. And it explains why it is used, because of its properties, we all know. And that's a wonder. The properties of asbestos is a wonder, but for sure we all know it's deadly. So what is done for primary prevention in Germany? Since 1940 they had guidelines of the institutions for statutory accident injuries insurance and prevention. We call it the Berufsgenossenschaften, reducing asbestos dust exposure. And I will tell you, this doesn't mean anything, not much for the protection of the workers. It was already bring out in 1940. Then we have 1973, a regulation that every company which uses asbestos dust has to notify it to the Berufsgenossenschaften as a harmful mineral dust. In 1979 there was a ban of asbestos spraying products, but still this did not reduce the diseases as we see now. And the only thing what was effective was the ban of asbestos in 1993, ban of production and use of asbestos in Germany, and with exemption for demolition and cleanup and maintenance. That was the only measure what really shows an effect, and this, I saw you the slide that the consumption in Germany was, after 1993, it was ended. Secondary prevention in Germany. Since 1973, there was an obligation to undergo occupational health screening before, during and after asbestos exposure. So even after cessation of exposures, those workers who were previously asbestos exposed have to be regularly examined. This was established in 1973, and 1 year before, in 1972, the register, the central register, was established, the agency for employers to asbestos dust, by the Berufsgenossenschaften, the statutory accident insurance institutions. And since this time, since 1972, every male and female worker who work with asbestos has to be notified to this register. So at least most of them are registered, and we can still follow them up for secondary preventive examinations. These are the data what we have in this central register. At the moment in 2007, you see that more than 500,000 formerly asbestos exposed workers are registered, and they are offered regular screening examinations, which are done usually every 3 years, but in high-risk groups it can be also every year can be done. So more than 530,000 workers are now registered still in Germany, and regular screening examinations are offered to them. What is done during these examinations? First, there is a detailed employment history, a medical history, of course, physical examination, pulmonary function testing, chest X-ray, and computer tomography in high-risk groups, depends on the indication. This is a program what is offered to these workers. And I come to the liability for asbestos-related diseases in Germany for employees first, which is quite different what I understand what is going on in the USA, for example. By the statutory insurance scheme for occupational accidents and diseases, every worker is insured when he is employed. And the Berufsgenossenschaften are the corporations under public law who are responsible for the detection of occupational diseases, for the compensation, and for the therapy. Every individual who is employed is covered by this insurance program. These programs are exclusively funded by employers, and it meets all medical related costs and compensation. And in Germany it's not, or almost not possible to make claims against employer institutions or companies. So this is a different insurance system. The employers, they give the liability to the insurance companies, and there's no more possible that there are claims against employer. That's a small difference we have. So in the list of occupational diseases at the moment, in the Ordinance of Occupational Diseases, occupational asbestos-related malignancy are listed under two numbers, the number 4104 and 4105. 4104 is lung and laryngeal cancer in combination with asbestosis, with asbestos-related disease of the pleura, or if there was a cumulative asbestos dose of at least 25 fiber years. So when this combination is there, lung cancer or laryngeal cancer, and one of these is found in X-ray or CT scan, or it's calculated that the exposure was more than 25 fiber years, so every lung cancer and laryngeal cancer will be compensated. In mesothelioma, any occupational asbestos exposure and the diagnosis of mesothelioma of the pleura, peritoneum or pericard will be considered an occupational disease. There are also mesothelioma cases we saw in our clinic after household exposure. There was no other occupational exposure and no environmental exposure, and there was a relatively high household exposure because the clothes, mostly of the men, were cleaned at home by the women in the 50s and 70s. And you see the latency period after 20 to 40 years, the women, they suffer from mesothelioma. And there was a long debate in Germany, which was many years before court, if this is an occupational disease. The lower courts, they decided it is an occupational disease, it has to be compensated, but the German Federal Social Court said it's no occupational disease because a household exposure is not covered by the insurance scheme for occupational accident and diseases because these are non-employees. So that's the current situation in Germany, and at the moment it's at the Constitutional Court, and it will decide whether this is also an occupational disease. At the moment it is not. But in this case, these women, they can look for liability for the companies, but it's very difficult to sue them. You have to prove that they know already the dangers of asbestos during this time, and there's no case which is solved before court until now. Okay, therapy and palliative care. Palliative care, I think, is a very important offer to those patients with lung cancer and mesothelioma. Most of them are not diagnosed in early stages. We have a surgery option, I think, in early stages, and or sometimes palliative operation is necessary, but I'm very skeptical about these extensive operations because the patients we saw, they don't have a good quality of life when they have these extensive operations. Immunotherapy, there were some single cases or few cases who showed remission after therapy with interleukin-2 or interferon alpha, and one chemotherapy combination, pemetrexed and cisplatin, is now also offered to these patients with mesothelioma. You see a response rate around 40%, as we saw also earlier, but still its the survival rate are poor, especially for mesothelioma, and only for lung cancer, when the stage is early, there is a cure by operation. I think the individual multimodal therapy is the one of choice, so you have to evaluate every patient to find out what is the best therapy for this patient and his mesothelioma. It can be chemotherapy, it can be operation, it can be all together, and radiation included. At least the costs are covered by the Berufsgenossenschaften, but as I told you, the survival is poor. So what did we learn from this? First, we have occupational diseases, so they can be compensated. This is necessary, of course. The treatment costs will be covered by the insurances, but doesn't prevent anything. So we have to do the best for these patients. The secondary prevention by early diagnosis is tried by these regular examinations, but we know that it's not very established that we have really early diagnosis, and we don't know the effect of this measurement, of this secondary prevention and screening this patient. So the only thing, I guess, what we can do is ban asbestos. It's the only thing what we can do at the moment. And this is my final slide. And if anybody of you is in Cologne, I'm very happy to see you there and show you around. Thank you very much for your attention.